Hi, my name is Dr. Stephen Offenburger.
I'm Dr. Tom Danisiewicz.
Today we're going to be talking about migraines and really answering the question that you're here for. Do you actually have a migraine, or maybe it's something else that can be treated? So the first question, Tom, that everybody has on their mind, that everybody wants to know, do they actually have a migraine, or is it something else that they can be treated for and get relief from? So in your clinical practice, what were the signs and symptoms that people had when they came in with a true migraine?
So first I want to say, everyone who comes into our clinic with a headache, it is something that is significant to them, it's severe, it's the reason that's driving them into the clinic. Yep. But when we do see the true migraines, a lot of times we have some symptoms besides the headache that are pretty severe as well. Yep. You're going to have maybe some nausea with that headache, or maybe even going so far to actually vomit with that headache. They're going to have really bad light sensitivity, yep, to the point where they maybe don't even want to get out of bed for a couple of days because anything that's really intensifying that headache is just too much to bear. So, Steve, as far as the migraine, really, why do people get migraines?
Yeah, it's an interesting question, and unfortunately, we're probably not going to get to the answer on here because the answer isn't really well known. We've talked with migraine specialists here as a company, and unfortunately, in the research and even in clinical practice, there's not always one defining thing that causes migraines. It's usually a complex array of symptoms that is causing something very complex with the patient, and there's a lot of different multifactorial problems going on. So when we're looking at a patient at Airrosti, what is one of the ways that we use treatment in order to differentiate a migraine from a headache, or these recurrent headaches, or some of these more severe cases? What's the musculoskeletal components that you think about as a clinician?
Yeah, so I think we look at a lot of clues that different muscles and different joints can refer pain along these, we can call them myotomes, or just kind of referral patterns for muscles and joints that mimic headaches and mimic very common headaches like migraines and other types of headaches. And what you're typically going to look for is you're going to look for problems in the neck, you're going to look for problems sometimes in the jaw, sometimes even in the shoulder that are going to reproduce pain that goes along the head or around these bands. And what you're going to see is that the patient has a really positive response to treatment there. You know, they're going to feel first that when you find them, they can reproduce a little bit of the headache, and then as you treat those areas, you're going to see a decrease in the intensity of those symptoms. Where someone who has maybe a true migraine or a different type of headache that's not musculoskeletal, you're not going to be able to find those areas that reproduce their symptoms as well, or maybe you're going to be able to make them worse and not get any sort of relief out of those spots.
It's funny that you mentioned that. In my clinical practice, I always remember asking patients, hey, I'd push on something and go, hey, does that reproduce your headache? And they say, yeah, that's exactly the place where it hurts every day. So we kind of already knew, oh, this was the trigger area, or this was the spot, the point, however you want to kind of think about it, that was actually causing this referral into the head. And the patients were always surprised because, like you said, it wasn't in their head. I was pushing on the back of their neck, somewhere along their trap, even kind of making them move their jaw around to kind of understand where it was coming from.
And that's the musculoskeletal component to a headache that's not a migraine, is you can reproduce it with some level of stimulation to the muscle of the joint that's causing that problem.
So let's just say that somebody does have a head pain. They don't know if it's a migraine or a tension headache or any kind of musculoskeletal headache. What do we do at Airrosti that tries to help that patient, whether we can treat them or whether we can't?
So we would do the same thing with that patient that we do with really any patient, which is we're going to take a very thorough history, understanding the nature of the complaint. We're going to do a very thorough evaluation, make sure that we can reproduce a little bit of those symptoms from a musculoskeletal standpoint. Yeah. And so once we do know that they're in the right place and they're appropriate to get treated, we're going to look for some level of reproduction of pain from those musculoskeletal points and some level of improvement once you do the conservative measures.
Yeah, it's really starting with that diagnosis, that really thorough history, making sure that you're in the right place, that this is something that we can treat. And if not, we're going to send them out to the specialist that they need be, because the best diagnosis is really to a migraine specialist, somebody that's really trained in neurology.
So, Steve, you are someone who has a headache, has head pain, you're not quite sure what to do, you watch this video and you're like, well, maybe that's where I should go.
Are you more confused now than you were in the beginning?
Where should you go? What should you do?
You know, we really encourage everybody to kind of utilize something that we offer as a product, just called a VIP chat. It's just a way for a no obligation, complimentary visit for you and a doctor in a virtual setting. You can get up to 30 minutes with one of our providers just talking. You can ask the questions that you have, right? The provider will listen to you, take a thorough history, and really kind of evaluate, yeah, I think it's this or I think it's that. And that way we can point you in the right direction. Maybe it's care from us, maybe it's a care from someone else, maybe it's a specialist along the way. Whatever it is, the right place at the right time. So if you like today's video, you can see a link down below to the VIP chat. We appreciate you today. My name is Dr. Stephen Offenburger.
I'm Dr. Tom Danisiewicz, and we'll see you in the next video.